Hi, I'm Alicia. Hi, I'm Kelly. Hi, I'm Lauren. And we are students of radiology at UTFPR, and this is our work on disc herniation. The spine is the main supporting structure of our body. It allows us to perform movements such as bending, rotating, and maintaining a straight posture. It is formed by vertebrae, separated by intervertebral discs, which work as natural shock absorbers, protecting the spine against impact. Each intervertebral disc has an internal gelatinous nucleus and an external fibrous ring. The disc hernia occurs when this internal nucleus moves outward due to a crack in the external ring. This dislocation can pressure nearby nerves, causing pain, tingling, and even motor difficulties. This condition can occur anywhere in the spine, but it is common in the lumbar region, as this area supports most of the body's weight. It can also affect the cervical region, causing neck and arm pain. It is estimated that about 80% of the adult population will suffer from spine pain at some point in their life. And the disc hernia is one of the main causes of this problem. The disc hernia is a condition that can affect anyone, but some factors increase it. Like aging, repetitive movements, excessive effort, and trauma to the spine are some of the main causes. Although it is a very common condition, the disc hernia can be avoided in many cases with simple measures that will be addressed in this video. In addition, it is essential to pay attention to body signs. Persistent back pain, tingling, or muscle weakness can cause a problem in the spine and should be assessed by a health professional. The disc hernia can be caused by different factors. One of them is aging. Over time, the intervertebral discs lose water and elasticity, becoming more susceptible to rupture. This natural process is called discal degeneration and occurs with age. Imagine a new and moist sponge. It is flexible and absorbs impacts. Now think of an old and dry sponge. It rips more easily. This is what happens with intervertebral discs over the years. In repetitive movements, some professions require the constant realization of the same movements. This can overload the spine. As professionals who are painters, factory workers, and printers, they can develop disc hernia due to the repetitive use of the same muscle groups and joints. Overexertion: lifting weight incorrectly increases the risk of disc injury. Example: lifting heavy furniture without bending your knees puts too much pressure on your spine, which can cause a slip disc to slip. This is common in construction workers and weightlifters. With trauma, direct impacts on the spine can cause disc herniation immediately or accelerate the wear and tear of the discs over time, such as car accidents. High-altitude falls and high-impact sports such as American football can result in this condition. Symptoms of disc hernia. The symptoms of disc hernia vary according to its location and the gravity of the nerves. Symptoms can be asymptomatic, being identified only in image exams carried out for other reasons, or cause light-intensity pain, in which the patient may feel discomfort located in the spine. This type of pain is usually intermittent and improves with rest. It can be moderate, in which the patient may have a more intense and persistent pain, or in severe cases, in which the pain may be incapacitating, which constitutes a medical emergency. It is also important to note that the presence of a disc hernia detected in image exams does not necessarily mean that the patient will have symptoms. Symptoms of disc hernia. The symptoms of disc hernia vary according to its location and the gravity of the nerves. Symptoms can be asymptomatic, being identified only in image exams carried out for others. The main symptoms of disc hernia include pain, discomfort in the affected region of the spine, be it the lumbar, thoracic, or cervical, which can radiate to other areas. The intensity can vary and can be aggravated by specific activities, such as sitting for a long time or standing up, carrying weight or making sudden movements. Another symptom is tingling or numbness, which are the sensations of numbness or loss of sensitivity in the areas affected by the compressed nerves. There is also muscle weakness, which is the decrease in the muscle strength of the arms, feet and legs, making it difficult to perform daily activities, such as holding objects, walking long distances or even climbing stairs. There is also the feeling of burning in the affected areas, which can manifest as heat and burning, and the difficulty of movement, which is the limitation of movements due to pain or weakness. This can generate joint stiffness, which worsens mobility even more. And in serious cases, there is loss of urinary or fecal control, significant weakness of the lower limbs. According to this image, which is there on the side, you can see that the pain is radiating to other parts of the body. The specific symptoms are lumbar hernia, pain in the lumbar region, which can radiate to the buttocks, thighs, legs and feet, frequently associated with the compression of the sciatic nerve. Thoracic hernia, pain in the central part of the spine, which can radiate to the ribs, in addition to tingling or numbness in the legs. And cervical hernia, pain in the neck, which can radiate to the shoulders, arms and hands, accompanied by tingling or numbness in these areas. The specific symptoms are lumbar hernia, pain. Diagnosis of disc hernia. The diagnosis of disc hernia is a process that combines the detailed clinical assessment with imaging tests to determine the location and extension of the injury. Diagnosis of disc hernia. The diagnosis of Still talking about the diagnosis, a clinical assessment is done in which the doctor begins by collecting the patient's complaints, investigating the nature, duration and intensity of the pain. In addition to possible aggravating or attenuating factors, conditions associated with trauma history, previous surgeries, rheumatological diseases or risk factors for neurological complications are also considered. The doctor also pays attention to the patient's muscle strength, in which a test is done of the strength of the muscles innervated by the possibly compressed nerves. Evaluating the symmetry between the sides of the body and the patient's ability to perform movements against resistance. The doctor examines the warning signs, which are the symptoms that may indicate an aggravation of the picture, such as urinary incontinence and muscle weakness in the perineal region, and the physical exam is carried out, which are specific tests to identify the main focus of pain and assess the neurological function, in which the patient's sensitivity and reflexes are seen, in which there is the verification of areas with altered sensitivity, such as dormancy or tingling, using light stimuli such as touch or needle, and the assessment of the tendinous reflexes to detect possible neurological alterations. The diagnosis of disc hernia can be carried out by means of clinical assessment associated with image exams, which help confirm the suspect and determine the severity of the condition. These exams allow us to visualize the structure of the spine with different levels of detail, helping to identify the hernia, its size and its relationship with the other nerves and tissues. One of the main tests used in this process is magnetic resonance, which provides detailed images of the intervertebral discs and nerve structures, allowing to identify the size and exact location of the hernia. They are used for diagnosis, computerized tomography and X-ray in specific situations, but do not give so much information about the disc and its relationship with the structures. Your doctor can also request an electroneurobiography to help with the diagnosis reasoning. In addition, although the X-ray does not show the hernia directly, it can be useful to assess alignments in the spine that suggest problems in the discs. Now, let's talk about the treatment of disc hernia. The treatment of disc hernia is varied depending on the type and severity of the hernia, as well as the symptoms of the patient. Some main modalities of disc hernia treatment are the change of habits, physiotherapy, medications, infiltration, and some surgical processes. I will be citing and deepening a little more on these topics to follow. Starting with physiotherapy, which is the main clinical treatment of disc hernia and aims to rehabilitate the spine through strengthening and stretching, and also has the power to treat contractures and inflammations. So, it is essential to understand that physiotherapy, as a very varied set of techniques in the treatment of disc hernia, must be individualized in each case to achieve the desired results. The second treatment is medications. Medications are of great importance in the treatment of disc hernia. The main classes of this medication are analgesics, anti-inflammatories, corticosteroids, muscle relaxants, and medications for neuropathic and chronic pain. The third treatment is infiltration or blockage of the spine, which consists of the infusion of medications directly into the spine to optimize the analgesic and anti-inflammatory effects. This procedure is performed in a percutaneous way, without cuts, and the patient receives the injection on the same day. Modern techniques and solutions allow the inflammation to also act in a regenerative way in the treatment of disc hernia. The main goals of infiltration are to assist in the process of reabsorption of disc hernia and provide a relief of symptoms during the period of physiotherapy. Optimizing its results, we also have microdissectomy. Microdissectomy is a process carried out with the help of a microscope to remove disc hernia. It is the classic treatment and the most performed for the treatment of disc hernia in the world today. In general, the incision measures about 3 centimeters, and the procedure has an average duration of 90 minutes, and the patient can go home the next day to the procedure. He can go to the postoperative immediately to the procedure and perform his basic care autonomously. We also have the endoscopic surgery of the spine. Recently, a technique was released that is minimally invasive in the treatment of disc hernia by video surgery. And the name of this technique is endoscopy of the spine or endoscopic surgery of the spine. The incision measures about 1 centimeter, and through it, the endoscope of the spine is inserted with an attached camera. In this way, with the help of these devices, we can remove the hernia with less tissue dissection, less bleeding, and fewer chances of infection, less pain in postoperative, high precociousness, and faster return to day-to-day activities. We also have the arthrodesis of the spine. The arthrodesis of the spine consists of the infusion, which is the stabilization between 2 vertebrae. It is used more frequently in cases of cervical disc hernia, and more rarely in cases of lumbar hernia. LT is used only when we suspect that the anatomy or the stability of the spine is compromised. After the surgical treatment, when well indicated and performed, the results are excellent. Now, talking a little bit about the prevention of disc hernia. So, develop healthy life habits, such as regular physical activity, stretching exercises. Exercises to strengthen the abdominal and paravertebral muscles, and a correct body posture are important measures to prevent spine diseases. Also, how to avoid overweight, obesity. Practice stretching exercises and strengthening the abdominal muscles. Avoid staying in the same position for a long time. Do not carry too much weight, avoid snoring, sleep well, have a healthy diet. These are a whole set of things that can benefit and bring this prevention to disc hernia. Our final considerations of the work is that disc hernia is a condition that can cause intense pain and functional limitations, compromising the patient's quality of life. Its development is associated with factors such as aging, repetitive exercises, incorrect posture, and genetic predisposition. The treatment depends on the severity of the case, including physiotherapy, medications, lifestyle changes, and in more serious situations, surgeries. Prevention through regular practice of physical activity and postural care is essential to reduce risks and avoid complications. Thus, understanding disc hernia and its treatment method is essential to minimize its impacts and ensure a healthier and more active life. Thank you for watching this video.